how to prepare for the next information crisis and the next health crisis. Any new health crisis will bring along an information crisis. We continue to have the problems we usually have, and also the information problems we discussed before that we already know they exist. So how are we going to prepare so that next time we are better prepared and better suited to address this situation? We need to bear in mind that disinformation is here to stay, and it is not going to disappear. The solutions suggested are usually restrictive of freedom of expression, and they become worse than the problem itself. So it is quite likely that we need to get used to living with disinformation, and that our work is key in mitigating and counteracting it so that it has the least possible impact. But knowing this, let us see how we can prepare for the next time. I think it is key to analyze disinformation. It shouldn't take us by surprise. We need to see the type of disinformation that circulated during other crises. Unfortunately, we do know what type of disinformation was circulating during the pandemic. We do need to take advantage of that and better prepare for the next time and what type of information will circulate. We need to see what is happening in other countries. In some countries, information starts and then moves on to the next one. We need to see what is going on in those countries, the disinformation in those countries, so that we can prepare best when that disinformation spreads to our own, and see what groups may be most affected, who would be the most vulnerable to disinformation. And when we think about our work on vaccines, and we planned our work in 2020 to use it in 2021 with the beginning of vaccination, the elderly will may be easier victims of disinformation, and we may need to prepare a system to address disinformation targeting the elderly. And what happened, at least in our situation, is that because the elderly lived the pandemic as a crisis situation in a fearful situation, they were the ones who got vaccinated the fastest, whereas the most hesitancy was among the younger group of people, because they didn't think that COVID was such a high risk, and they even thought that disinformation or the alleged adverse effects would not have such a big impact on them. So we needed to work more with the younger people than with the elderly. So depending on the context and the crisis we face, our target audience as to the most vulnerable audience will change. One thing we may do is to fill the gaps whenever we need information. If there is something that is unknown, this information will take advantage of it. It doesn't mean that we need to know everything, but to produce evidence and to have good scientific evidence takes time. We do not want to contribute to the confusion, but we can say what is not known and why, and to be clear about the unknown, so that if someone says something about something that is not based on evidence, that is clearly understood. And we need to bear in mind the questions that our audiences, our communities have, and also try to fill the gaps with the most simple language in any format that makes sense. It is not useful to send a PDF file that is available somewhere that is not going to fill a gap, something that is not easy to find and that is not speaking to the people who need it. Also provide tools to our audiences to search for trustworthy information whenever we go out to say that something is not true. For example, when Florencia was giving examples about the lack of vaccines, we can say this is fake because vaccine does not work in this fashion. This is untrue, because it doesn't mean that because two things happen at the same time, there is a causal relationship. Everything we know to counteract disinformation, that in that way we can help, so that the next time that information is faced with similar disinformation, that person has the tools to discard it, to ignore it. And also explain what is trustworthy and what is not. What are the trustworthy sources of information, and also make them available to people. We also need to know what type of disinformation is circulating. As journalists, we need to know what our audiences are discussing, the doubts they have, and also the disinformation that exists regarding what topics, in what format. Are these images, are those images that have been tampered with? That is to say, what is the type of disinformation that they have, and how can we counteract it so that we can create the tools for the individuals to know next time that something is not trustworthy? If there are several pictures that are circulating that come from a different country and they are not your own, you can look at the names on the street signs and also the car license plates to determine whether they match the ones in your own town or country, so that we can determine that something is false. This could be useful information for someone to have before sharing a piece of information. And it is also key to respond to the situation quickly. Here we need to strike a balance. Whenever we are going to counteract something that is not true, when something is so small that if we address it, we are going to enhance it, and we are going to become enhancers of a piece of information, even if it is to counteract it. And when something is relevant, when it is already circulating, when it has to be addressed. And the criteria that we need to bear in mind have to do with the viral characteristic of content. For example, if someone is using the traditional media, if it is something on several platforms, if it is something that is reaching to millions of individuals, we need to do it quickly. And the next aspect to take into account is how dangerous it is. So it would be dangerous if someone believes something, and so we need to participate. And also, disinformation travels very fast, and once it is spread, it is very difficult. It is more difficult to deny something than to act early. If we are able to find the information, the disinformation early, and we already see that it is reaching to a significant number of people, and that it is not something reduced, but it is something that is spreading, we know that if we can control it, those individuals who know that it is fake have fewer chances of spreading it. So we were able to curb the spread, but for that, we need to be on the lookout and do it quickly. And when thinking about the usual tactics used by those who misinform, something to bear in mind for us to identify those tactics, but once again, to alert, to warn our agencies that this is the type of strategy used by those who misinform, so that when they face them, they do not fall trap to them. On the one hand is the cherry picking. That is to say, they just choose whatever it is suitable to them. We see this, for example, whenever a paper had not even been peer reviewed and someone said, well, this proves my point, it doesn't matter that there are another 50 that say the opposite. So this is the fallacy of authority. For example, when it says that the Nobel Prize says so and so. And sometimes that Nobel Prize had not even said it, and it could be that someone that was awarded the Nobel Prize may say something whenever something is beyond his or her area of expertise. But just to use this fallacy, this falsehood, that because someone says something is true, that is incorrect. So also to make to take the correlation as causality and impossible likelihood, the impossibility. If something is not 100% safe or trustworthy, then we need to reject something. And this also applies to generalization, or for example, my aunt had this problem and this is going to happen. and then also to use these general concepts as evidence. And when we're talking about anecdotal evidence, other strategies. I am not saying that this is true, but I wonder, wouldn't it be possible? And then they just publish some disinformation. We cannot check a question. We cannot say that the question is fake. We can say that the question leads to something that is false, but that also turns to a more difficult situation because it is presented in a deceitful way. And the same as to create, to the same goes for conspiracy theory and also the use of these theories by people who misinform. And also when we assess what to do in terms of disinformation first, what is the risk of believing in that misinformation? Could there be a direct risk to health, to life? We also need to look at the viral aspect of disinformation, how quickly it spread, and also, if possible, to counteract the content. If this is circulating over WhatsApp, let's use WhatsApp to counteract that information. Let's use the same platform that this information is being spread on. And also think about the type of content needed to deny something, and also how to reach to those individuals that had access to the disinformation. And throughout the process, we need to do it in the most empathic fashion. Those who believed in disinformation maybe did it because they were sharing something that was useful. We need to be empathetic, and we also need to convince them with the best possible arguments, with transparency and clarity in terms of the information we have, so that the next time they find similar content, they do have the tools to address it.